Congrats on making it this far. Today we're going to talk about post-operative course for after surgery. I want to reiterate that surgery is safe. It is a safe and great way to lose weight. The signs and symptoms to look out for and let me know as your surgeon are this. If you aren't able to keep anything down, if you're nauseous, if you're vomiting, I want to know. And I'll direct you one of two ways. Either come see me right away or go to the ER, but I want to know either way. Now today, we're going to go over what to expect before surgery, the day of surgery, and after surgery. I'm happy and honored to be taking care of you through this whole process. So let's dive in. So 2 weeks before surgery, you've done all your prerequisites. That's hard work. Good job. But you're still not the starting lineup yet, but we'll get you there. So 2 weeks before surgery, I make you do a clear liquid diet. You're gonna be hangry at me. It's okay, but why not help your surgeon out? It'll help with your liver and make your surgery safer for me. Now we're at surgery day. What to expect? You're gonna get to the registration office and it's gonna be about an hour to 2 hours before you get to surgery. They'll check you in, and once they get checked in, you'll get an IV, you'll get a gown, and get you all ready. That whole process takes another hour separately. Now, surgery itself probably takes an hour for you, but it's the nice nap. You won't know time. For your loved ones, it'll feel like forever. After surgery, I'll come find out where your loved ones are at in the lobby and tell you how everything went. Then, when you are done with surgery, you'll go up to your hospital room for one night, hopefully, and the next day you get to go home. You're not just laying around in bed after surgery, you're walking to help with the gas pain and get rid of a lot of the pain that you have in your abdomen. Afterwards, when you go home, you'll be following and referring to this booklet to go over the diet. At any point in time, one thing I want you to do is write down your questions. I'm happy to answer them and happy to guide you and help you along this journey. Now, we've probably gotten to know each other pretty well throughout, even before I make an incision. So I want to help you for a year, 2 years, 5 years, the rest of your life to help you keep this weight off. Now, you might have some questions while you're at home and you've just been discharged. Is it okay for this? Is it okay for that? A go-to thing is I answer your questions on the portal, or you're welcome to call. There's someone always on call that can help answer your questions. But this booklet's a good reference point as well. So go ahead and take this out after you get discharged if you do have questions. Now, it's gonna feel like you did 1,000 sit-ups without the abs, but we'll get there. It'll take some time. So it'll be sore. What you can use is ice for the first 48 hours, and that'll help. After that, start using massaging and warm hot compresses, and that will definitely help. You might notice getting up and down from your bed takes a lot of that core. That's pretty normal, and one side might hurt worse than the other side. And that's pretty normal as well, because the incisions that I make, there's one big one, and that one is usually the one that hurts the worst. So one of the biggest problems that you can avoid after surgery is dehydration. You have to stay on top of your drinking of water, and more water after surgery. Take a little medicine cup, pour in the water, and set an alarm for 15 minutes. You have to take little sips every time because you can't chug. And unfortunately, it's very hot where we live, so make sure you're staying hydrated. If you're having issues, call me, let me know. I want to know you're my patient. Congrats on making this far again. I'm excited to help you on this journey. Good job watching this video. And best thing about this video, you can watch it again. If you have more questions though, I'm happy to answer them. So write them down and I'll answer them at your next appointment. Good luck, good job. I'm on your corner and I'll see you soon at surgery day.